Children use cell phones to watch TV, play games, make phone calls, and send text messages. Many older kids and teens have their own cell phones, which they are attached to 24/7. But there are risks to such frequent use by children. And if so, is that different than the risks for adults? Cell phones emit a type of radiation that is known as radio frequency electromagnetic radiation. There are several studies of impact of cell phone radiation on children. In general and on average, children suffer a higher exposure of their brain regions than adults. This is because children have proportionately smaller heads and brains, yet receive the same levels of cell phone radiation as adults. When used by children, the average RF energy deposition is 2 times higher in the brain and 10 times higher in the bone marrow of the skull compared with mobile phone use by adults. People who begin using cell phones before the age of 20 are at an even higher risk of developing brain tumors than people who begin using these wireless phones as adults. This is because of the closer proximity of the source of radiation to the brain of kids. Research also suggests that cell phone exposure could affect children's behavior. Children become hyperactive and have bad emotional and behavioral problems, including trouble getting along with other kids. These problems occur when the mother uses a cell phone during pregnancy. Children who use cell phones are more likely to have ADHD. ADHD is a disorder that makes it difficult for a person to pay attention and control impulsive behaviors. Children using cell phones are at a higher risk of getting brain tumors and cancer. Here are some tips for you if you are giving your phone to a child. Turn airplane mode on when giving a child a technology device, or when a cell phone is near a pregnant abdomen to prevent exposure to radiation. Turn off wireless networks and devices to decrease your family's radiation exposure whenever you aren't actively using them. As an easy first step, turn your Wi-Fi router off at bedtime. Decrease use of phones or Wi-Fi where wireless coverage is difficult. In order to avoid an increase in radiation exposure, use the speakerphone or a plug-in earpiece when you use a cell phone. To protect children from radiation, they should not use cell phones, except in emergencies, and should use the speakerphone. How old were you when you started using a cell phone?